the Executive Director of Harris County Public Health and the Health Authority for Harris County. And today I'm wearing my white jacket, my white coat here, and I join my colleagues, Dr. Klopman, Dr. Porsa, Dr. Boom, and I really want to say thank you to our community. You have helped people like us to continue to be able to fight this virus and not see an overwhelming surge in our healthcare system. Dr. Porsa is absolutely correct that we have done a fantastic job thus far, and we have flattened this curve, and that's because all of you have helped us. But today is a new day. We are now starting to see things that are reopening. We cannot let our guard down. We have to make sure that we're thinking about this as a long pandemic, which it is. This is the first quarter of a football game, but we have a lot of work still ahead of us. And I know the judge outlined earlier this week the 3 T's, and I do want to remind everyone of test, trace, and treat. Our colleagues here about the treatment piece, and I cannot thank them enough, and all the ones that you represent in the healthcare system for everything that you all have done, our doctors, our nurses. I would even give a shout out to my emergency department docs and nurses that I work with on a day-to-day basis over the years. I want to say that they are amazing heroes for this fight, and we could not have done this without our community. That said, we know the foundation is testing and testing, 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 and we're doing everything we can to increase that testing capability in the county and throughout our region. At the same time, as we unveil today this gratitude to all of you for the teamwork, it does also put into that second T about tracing. Contact tracing has been used by public health for decades. It is used across the globe. This is what we do as our epidemiology program in terms of contacting people who may have been in contact with a confirmed case. What we're asking you to do is to support that. What that means is that as you get back into society, again, facial coverings, washing your hands, making sure you're socially distanced, and all the messages that we've been saying over and over again, we have to make sure that we underscore those. And if you don't have to go out, please don't go out. This is not the time to get back in, especially if you're older, a senior, above the age of 65, or have chronic health conditions. We want to make sure to emphasize that. But what we mean by support contact tracing as well is keep notice a bit about who you're around. And if there's a way for you to keep track of that, because if 3 days from now you test positive and we contact you to say, hey, who have you been around, and you don't remember, that makes our job extremely difficult in public health. And so we're asking you to be thinking about that. That really helps all of us in a situation where, unfortunately, if you are tested positive. Now, the good news is, again, readyharris.org for our testing. Please go to that online tool that we have, 832-927-7575, to get tested. And the final message of this is that from the tracing standpoint, if we do have to contact somebody for contact tracing, we make sure we assure the privacy of that individual. We do not share that information for other purposes. It's only to fight this virus. And with that, thank you for everything you're doing to help us fight this virus, and keep up that great work. Thank you.
Thank you so much, Dr. Shaw. We'll hear from Dr. Mark Boom with Methodist Hospital.
Thank you, Judge Hidalgo, and thank you, everybody, and good morning. You know, we're here today with a better topic, but a topic that I think we all agree on we're not done with yet, really because of what's happened from all of you over the last 6 or 7 weeks. When Judge Hidalgo and Mayor Turner issued a stay-home order on March 24th, and people followed that, epidemiologists would have predicted ahead of time that it would take about 2 or so weeks to see an impact of that. And sure enough, on April 10th or 11th, we saw what looks like a peak in the number of cases, a peak in the number of hospitalizations. And since that time, we've come down, and hospitalizations are lower, infection rates are lower, but they've not come down dramatically. It's not a steep decrease. It is a slow decrease with a little bit of a plateau that's occurred. But as a result of those great actions from our leaders, as well as all of you and the sacrifices you've made, we're in a very different position today, one where we have some optimism for the future, but where the actions we all take together will determine where things go. So So I want to talk a little bit about the governor's order and where we are today. The governor's order was about slowly and thoughtfully opening back up businesses. It was not about returning our social lives to normal, as much as we would all like that to be the case. In fact, the very first part of his order states that unless you're using an essential business or one of the reopened businesses, you should be staying home. You should be minimizing contact with non-family unit or non-household members. And very importantly, as has been said by my colleagues, anyone over 65 or with risk factors really should continue to be staying at home. And we've done well because of the social contract that we all effectively signed with each other. We've all done the right things to protect each other. Those must continue. From the governor to the lieutenant governor to Judge Hidalgo to Mayor Turner to the leaders of the Texas Medical Center, everyone agrees that wearing masks in public is a good thing to do. And we urge everybody when they are in public to wear their masks. We urge everyone to use great hand hygiene, social distancing, all the practices that we've been talking about. I want to talk a little bit about faith institutions. Last week, over 80 churches signed essentially a pledge to say that throughout May, they would not go back to worship with anyone over 50 individuals. The leaders of the Texas Medical Center strongly and unanimously support that position. Now is simply not the time to pull big groups of people back together. I also want to talk a little bit about hospitals. There's a lot of information out there starting to suggest that people are avoiding getting necessary care. And we're very concerned about that, quite frankly. To give you some perspective, I'll use our data at Houston Methodist, but this would apply to all of the hospitals. We took care of and have taken care of about 700 patients in the hospital with COVID. During that same 2-month period, we've admitted over 15,000 people, much lower than normal, but 15,000 people for emergent care that they need, and we've done so very safely. And now is a time to start providing care back to people who need urgent care that has been deferred. We know we can do that safely, and we don't want to have a second tragedy of people having illnesses and suffering because they're not seeking care. So please work with your physicians, work with your hospitals and others to seek the care that's necessary. And then finally, as we emerge from this and as we move forward and we watch this, it looks like we're in a little bit of an equilibrium right now with the virus. So the virus decides where we go next. But we also can impact how the virus decides where we go next by the actions we take, all the things we've been doing. And one of the things we as leaders of the Texas Medical Center have done is put together a set of dashboards. You can go to the Texas Medical Center website, and you will see those warning signs that we are watching to make sure that as we ease restrictions, that we don't see the virus getting out of control. I promise you we will raise our hand and speak loudly if we do see that happening. With that, I'd like to again thank all of the first responders, all of the wonderful people working across the hospitals to care for individuals, and all of the other people who've been keeping our community going during this time. And thank all of you for your wonderful actions. God bless.
Thank you so much, Dr. Klopman with Baylor.
Thank you. I'd also like to say congratulations to Houston for what we've been able to accomplish so far. But one of the other things besides having wonderful people here is we have a fantastic medical center in the Texas Medical Center and a tremendous number of really outstanding academic institutions. And what you may not know is when that 3 T's, the third T, treatment, but when you don't have effective treatment, you have to rely on public health measures, which we have been doing, and very effectively, and that's really on you, us all, and the public. But we are beginning to get some sense now that there are going to be effective treatments. I know Methodist, Baylor, and several other institutions participated in the clinical trial for remdesivir, which is the first antiviral that's coming online that looks to be effective against treating this particular COVID-19. It's a very well-established scientific principle. It interferes with how the virus replicates, and we got a very positive signal from that, and so there's real reason to be optimistic that at least we're beginning to have a therapeutic that works, not something we're making up, something that actually works. The second thing, to emphasize something that Dr. Boom said, we have the ability to look at a virus and actually sequence that virus and know exactly where it came from. And we have done this in many, many cases. And the virus that we see is coming from the community. It's not coming from inside hospitals. There's no risk so far that we know of that you come to the hospital or you come to a community health center and you acquire the virus. So if you need care, you should feel comfortable doing that. We can't actually tell where that virus came from, and right now it looks like it's really always coming out of the community. So I think that should be reassuring to the public. If you need care, you should talk to your physician and begin to start getting care. I think we just have to keep it up. I think one of the great resources we have in Houston and in Harris County is that our academic medical centers are working very hard to find new discoveries, new treatments, and we will participate in everything that's coming up that's new. We're all participating in the convalescent serum, for example, and that includes our public hospitals and our private hospitals. We're all participating, and we will be with you. I think our academic communities are here to support everything, all the good work you all are doing, and I hope you look to us for facts. We are the people who can give you actually the information you need to make intelligent decisions. So seek out us for facts, and don't seek necessarily the internet or Facebook for everything you read, because a lot of it's not right. Anyway, thank you, Judge.
Thank you so much, Dr. Klopman, for the research you're doing and keeping us all abreast. I spoke with Dr. Klopman, Dr. Boom just yesterday about the strategies we're taking, and we're watching very closely the guidance that they and other experts are sharing with us. One of the things we've discussed, and we've discussed this with Dr. Shah as well, is if folks begin going out more than they should today, and to reiterate, unless you have to, you really should not. We won't see that spike for another 2 weeks or more. So just remember, these guys and we are going to be watching, but we want to be caution folks that if we don't see a spike tomorrow or next week or in 10 days, that does not mean that we're not going to see one once that incubation period of the virus is through. So that's just something that I'm looking at and wanted to share with the community. So we'll open it up for questions. Folks are here. I know Dr. Klopman might have to leave in a little bit, but the rest of us are here to answer questions as well.
Juez, para los medios en español primero, ¿qué sucederá con aquellos negocios que decidan abrir sus puertas el día de hoy, que no decidan abrir sus puertas el día de hoy? ¿El condado los va a respaldar?
Repítame, los negocios, o sea,
Aquellos negocios que decidan no abrir sus puertas el día de hoy, ¿el condado los va a respaldar?
Bueno, los negocios pueden abrir las puertas si es que son negocios esenciales bajo las órdenes que ya han existido, o si son negocios que se pueden reabrir bajo la orden del gobernador. Eso es ventas, restaurantes, todo eso 25%, lo que él ha escrito en su orden. Que puedan abrir no significa que deban abrir. Entonces, le pido, si usted trabaja para uno de negocios, pregúntele a su supervisor. Si usted es supervisor, dueño de negocio, mire si es esencial o no esencial. Todavía puede contactar al condado con preguntas. Y también recordar, si ven negocios abiertos que no deben estar abiertos, repórtelos. Estamos trabajando con todos los oficiales para intentar manejar eso, si esa es la situación que necesitamos ir y notificar a un negocio que debe cerrar, que no ha cerrado, lo haremos. Hay una línea de atención en readyharris.org para reportar negocios que no deben abrir.
Usted como juez, ¿qué hará una vez que vea el incremento en casos y muertes en la fase 1?
Otra cosa que recordar es, estamos trabajando por contener. Entonces, esta estrategia de tratamiento, de rastreo y de pruebas es para intentar contener el virus. El éxito solamente llegará si es que tenemos la colaboración de la comunidad. Por eso hoy no es día de celebración y de todos salir. Si empezamos a ver un incremento en los casos que sea preocupante para los líderes hospitalarios, para nosotros, habrá que hablar con el gobernador, ver qué vamos a hacer, y pues la solución sería tener que volver a cerrar. Entonces, es posible que esta estrategia funcione, esta estrategia de abrir poco a poco, pero solo va a funcionar si todos nos ayudan a hacerlo así, poco a poco. En el condado seguimos ayudando lo más que podemos. Hemos asignado ya $10 millones a pequeñas empresas, $15 millones adicionales a individuos que no puedan pagar la renta, los biles, incluyendo comunidad inmigrante, y seguimos viendo qué se puede hacer, pero la idea es que si tenemos una recaída y toca regresar a donde estábamos hace un mes, sería peor, aún peor para la economía, porque tendríamos que esperar todo un mes más para volver a donde estamos hoy día. Entonces, lo mejor que podemos hacer es poco a poco tener cuidado, respetar estas recomendaciones y así intentar que salir de aquí exitosos.
¿Cuál es el estatus actualmente del fondo para la gente más necesitada y todavía se puede solicitar para la ayuda?
El condado aprobó el día martes pasado, este martes, se aprobaron $15 millones para las personas más necesitadas. Recuerden que esta comunidad siempre se une para apoyar a todos. Ahora, este reto es diferente porque no solo nuestro condado, sino todas las ciudades, todos los condados, países están enfrentando el mismo virus. Ya hace un mes creamos el fondo con 2 fundaciones para apoyar también a personas que están teniendo dificultad pagando la renta y otras necesidades. Ese fondo ha recaudado más de $11 millones y sé que se está distribuyendo los fondos. El fondo del condado de 15 millones adicionales, estamos trabajando, se aprobó el martes, toma un tiempo que los abogados revisen todo, trabajen con la fundación, porque eso se va a distribuir a través de una fundación para que sea todo independiente, en nada que ver con la política ni con los líderes elegidos, sino todo distribuido a través de una fundación independiente. Tomará un par de semanas a que empiece a fluir esos fondos y ya en cuanto tengamos más detalles le informaremos a la comunidad.
Y en español, por último, una persona indocumentada y sin seguro médico recibirá el mismo tratamiento y atención que aquellas que tienen seguro médico.
Sí, pero si usted es una persona indocumentada, inmigrante, recuerde, puede llamar a nuestra línea de atención para hacerse pruebas. Eso le pedimos que por favor lo haga porque así vamos a poder contener el virus. También los trabajadores sin documentos, si tienen un hijo ciudadano, pueden también recibir el cuidado de niños que ha establecido el condado en sociedad con la ciudad. Los fondos, los 15 millones, los estamos diseñando especialmente para aquellas comunidades que no reciben ayuda del gobierno federal, entonces particularmente la comunidad inmigrante indocumentada. Y finalmente, si se presenta a un hospital público, se le dará tratamiento. Las pruebas a través del condado son gratis, por eso lo invito a hacerse la prueba a través del condado. No se pide seguro, no se pide información, y en el hospital público no se le pedirá ningún tipo de información de ciudadanía y podrá llevar a cabo tratamiento.
Okay, good afternoon, Judge Hidalgo. I got a couple of questions here from our poll media. First question is, there are reports about possible fraud in the SBA PPP program. Have you heard anything about this? Have you possibly thought about doing a Justice Department investigation? And will you call for an investigation through Congress?
We've heard the reports as to the PPP program. I know that all levels of government are pulling together to try and support the community. Obviously, the federal government has the capacity to do a lot more. At the county, what we've been trying to do is serve as a bridge while those funds from the federal government arrive, or for folks who don't qualify for the federal funding, what can we do? And that's why we've established the Small Business Assistance Program, $10 million, an additional $15 million this week for communities who have trouble paying rent, basic necessities, and we're doing that through the Greater Houston Community Foundation again, and of course supporting the fund by the United Way and the Greater Houston Community Foundation. It's raised over $11 million also for direct financial assistance to help folks pay their bills, pay their rent. We will continue to look with our county attorney into any possible allegations where the county may be able to make a difference, be it through our own procedures or through any sort of other communication with other levels of government. But of course, the PPP program, not a county program, so unfortunately it's not under our jurisdiction, but we're watching closely.
Okay. Last question here. On Tuesday, Commissioner Court voted to hire 48 contract tracers. I believe this is 48 or 43. When will they start working, and how will they be trained?
So our efforts here at Harris County is to try and make this reopening a success. It's a timeline that perhaps I would not have necessarily chosen, but I am cautiously hopeful that it can succeed if we do our part and everybody else does their part, and that's what these efforts are about. And so we set out a goal. We need 300 contact tracers in addition to the ones we already have. On Tuesday, we moved to hire 48 supervisors. So these are the epidemiologists, the supervisors that are going to be managing the team of contact tracers. We're also recruiting and training volunteers. We're on our way. Probably the goal to have the first phase will be next week. We're not going to be able to hire all 300 at once, but what we hope is folks will do their part and do their part in staying home and using face coverings and supporting our contact tracers to where, as those contacts begin to happen, we can stop the virus in its tracks. Yeah, yes.
Just to clarify, the question was 48. It was actually 43, just to make sure that we have that clarified. Judge is absolutely right. These are epidemiologists, and these are folks that are supervising the team of 300 contact tracers that are being onboarded. It's not that we don't have contact tracers. This is to augment that, and we are ramping that up. So it's a ramp-up process where we're bringing in some percentage initially and then increasing over time. And that, just to clarify, in addition to what the judge just said.
All right. Thank you all so much. Appreciate everyone's support. Thank you.